Hi, my name is Dr. Marwan Sheikh. I'm a reproductive endocrinologist. Basically, that means I'm a fertility specialist with training that lasted about 3 years, specializing in that in the treatment of infertility patients. I started my practice in 1986, so I've seen the progress of different fields of infertility treatment from 1986 up till now. Today, our talk is going to be about tubal reversal. We do see a lot of referrals for this procedure, and I'm going to start by describing what is tubal reversal and who is a candidate for tubal reversal. Women who want to stop having babies, they ask their obstetrician to tie their tubes at the time of the C-section or right after delivery. And there are different ways of tying the tubes. For example, they can put a clip on the tube, which would be the best. They can burn and cut the tube. They can do a very common procedure called the Pomeroy procedure, where basically, essentially, they cut a small piece of the tube on each side. And there is a procedure that is not used anymore, which is called Issure, where they put a little spring gadget in the tube, which blocks the tube, creates scar tissue in the tube and blocks it. Unfortunately, very unfortunately, recently a lot of doctors have been doing what's called a self-injectomy for tubal ligation. What that means is they remove the tube completely. The idea from that is that ovarian cancer is thought to start in the tubes. So by taking the tubes out, then the chance of ovarian cancer decreases. Of course, not everybody agrees with that, and I believe that the patient should be given the option whether she wants her tubes completely removed or not, but this is not done. Now, as far as who is a candidate then for the tubal reversal, anybody who had their tubes tied but not removed. So we can almost open any tube. The only question is, an open tube has to be functional and able to move and pick the egg from the ovary. So a lot of things depends on how long the tube is left and how healthy essentially it looks. And that would be determined by reviewing the records. That's why if a patient is interested in tubal reversal, one of the first things we ask for is to get records of the operative report from the tubal ligation surgery, so we have some idea of how the tubes were tied. How is tubal reversal done? It's surgery. It's done by what's called a mini laparotomy. In other words, we make a cut above the pubic bone area, which is about 4 inches, and we go in and cut the portion of the tube that is blocked and scarred and put the healthy tubes together. We have to use magnification for that, as the opening of the tube is very, very small. So it's a very tedious surgery. It takes between 2 to 3 hours, which is unlike tying the tubes, which only takes basically 10 minutes to do it. You just put the clip and that's it, or burn the tube and that's it. The patient, after the surgery, stays in the recovery room for about an hour and then goes home. So it's an outpatient surgery. Now, a very common question I'm asked is, am I going to be having this surgery robotically with the robot, or by laparoscopy, which means putting a telescope through the belly button and untying them this way? Yes, they can be reversed this way. The only problem with that is to do it properly, it has to be done in the hospital, and the hospital charges an exuberant amount of money to do this procedure. It adds almost $10,000 to the procedure, which brings us to basically the cost of the procedure. The average cost is between $6,000 up to $7,000 or up to $8,000. It depends a lot on the BMI, which is configured by measuring the height and the weight of the patient. And depending on the BMI, how heavy the patient is, the price might go up, or if the patient has had other surgery. As far as the age limit for the patient, we can open the tubes in a 60-year-old, doesn't matter, but the question is she gonna get pregnant? That's why we have to be reasonable on who we choose for the tubal reversal. We've done them in women as much as 42 years old, but the patient is given a chance of pregnancy of less than 5% if you're 42 years or over. The success rate depends on a lot of factors, and that's one thing that I discuss with the patient. Age would be one factor. How much tube is left after the tubal ligation is another factor. How the tubes were tied is another factor. As I said, weight is another factor. So there's a lot of factors that are important in making that decision. In an ideal patient, a young patient, for example, who has had clips put on her tubes and she has regular menstrual cycles, the chance is 80 to 90% of pregnancy. As far as opening the tube, we can almost open the tube in all of these cases. And typically at the end of the surgery, we take pictures to show the patients that the tubes are open. Now, again, whether they will function or not depend on the factors I briefly discussed. Before I finish my presentation about this, I want to mention that there are alternatives to tubal ligation reversal. For example, there is something called in vitro fertilization, which when I started my practice, the chance of pregnancy was 5%. Now, in a young patient, the chance of pregnancy is 50 to 60% per cycle. The other options that patients have is something called InvoCell. InvoCell is basically this little gadget where we take the sperm and egg and put them in this gadget, and that goes in the vagina, stays in the vagina for 5 days, and we see how many eggs fertilized, and we put one fertilized egg 5 days later. The chance of pregnancy with that is about 35 to 40%, which is a little bit less than in vitro fertilization, but it's less expensive. All these other options will be discussed with you at the time of your consultation. Just to add a final note, that we do see patients for tubal reversal consultation in Jacksonville, Florida, and the Lake Mary / Orlando area. So when you call, you can specify exactly which area you would like to have the consultation. And if you have any questions, please don't hesitate to email me at M as in Mary, Shayk, SHAYKH, at assistedfertility.org. Thank you.